In Scotland, there are currently around 14,000 children and young people in care. Those with care experience are often disadvantaged in terms of educational outcomes, greater social difficulties and poorer health. Recently, the Independent Care Review highlighted the need to support children in care to have better health. To do this, we must recognise, understand and then address the barriers to good health for children in care. Our research will look at a wide range of health outcomes over time to build a picture of the health of care experienced children in Scotland. We will also take into account important factors such as age, type of care setting and placement stability.
This data links 10 different data sources, including birth registrations, social work data, prescription data and information on hospital admissions. Because the dataset is quite large, the linkage process has been very complex. As the data is very sensitive, it is being held in the secured Scottish National Safe Haven without any personal identifiers. Access to this data is very restricted. Data researchers must undergo data protection training before they are allowed to work with it. Additionally, any information or research results they produce are checked by trained staff before being allowed out of the safe haven. In this way, there are multiple mechanisms to protect the individual's privacy, and because we know so little about this vulnerable group of people, there is significant public benefit in undertaking the research.
GPs like me get snapshots of the lives of thousands of children as they grow up, and we find out about the childhoods of thousands of adults as they grow older and develop serious diseases. I first got to appreciate the long-term significance of care experience when my practice had to deal with the epidemic of injecting drug use in Glasgow in the early 1990s. A very high proportion of the patients in my methadone clinic had been maltreated and looked after by the local authority. A lot of more recent research has shown that serious childhood adversity has long-term consequences for not only mental health but for physical health too. Adverse childhood experiences cause people to age faster on average. I believe that it's crucial that we develop systems to monitor the health outcomes of looked after children so that we can hold children's services accountable and measure the impact of policies designed to improve the well-being of this most vulnerable sector of our society.
People who come to contact with care experienced children can give many examples of how individual lives are affected by the experience of care. From recent research, we have learned that care experienced children are less likely to attend the dentist regularly and more likely to have their teeth extracted. The initial look at our data also suggests that care experienced children come to more contact with the health services. For example, they have more hospital visits on average, and they also tend to see the health workers for very different reasons than other children. But we still lack a comprehensive Scotland-wide picture of the health of care experienced children. And so over the next couple of years, we're going to take a much closer look at the health of these children to provide a detailed overview of their health in Scotland.